Quiero hacer un breve resumen curricular del doctor Gideon Paret. Él es una figura distinguida dentro del marco de la pediatría mundial y él trabaja en la Sackler, en la Escuela de Medicina de Sackler en Tel Aviv, de la Universidad de Tel Aviv, y él ha estado en la terapia intensiva pediátrica del Shiva Medical Center. Él también tiene la jefatura de inmunología pediátrica. Él fue el primero en meter biología molecular a la terapia intensiva y ha sido de los líderes en lo que son los marcadores inmunológicos de la enfermedad en la pediatría y en la pediatría intensiva. Por otro lado, el doctor Paret tiene más o menos como 150 papers escritos en diferentes revistas médicas y fue el chairman del comité científico de la Israeli Medical Association. El currículum es largo, pero sobre todo es mi amigo, entonces le damos la bienvenida. Profesor Paret, Gidi, Bakasha.
I didn't understand the word that he's saying, but don't believe him. Your residents?
You're ready.
Come closer, I'd like to see you. Come closer. You're afraid of me? No. Good. Wonderful. I don't know what my friend Dr. Adiel has said, but while you're sitting, I must say that it's been a wonderful experience to be here in Mexico. You have a very, very interesting country. Your people here are wonderful. It's so nice to get up early in the morning and everybody says good morning and have a nice day. And it's really a challenge to speak about my journey from Sheba Medical Center, which is in Israel. I'll tell you a bit about the medical center in Israel, and to come to a great country with a great history and great people. So, Adiel, thank you very much for inviting me. And when I finish, I'll speak about a bit about my personal experience here in ABC. So, what I'm going to talk about is, I'm going to talk about Israel. Have you guys heard anything about Israel? You know where Israel is? Anybody heard anything about Israel? Yes. Good. I'm going to speak about the medical center I came from, which is the Sheba Medical Center. And I'll tell you about a bit my experience when I was a resident there, and later on when I was the chief of the Department of Pediatric Intensive Care and the chairman of the hospital. And then I'll tell you a bit about the Safra, the Children's Hospital. And if you is a pediatrician, is going to be a pediatrician? Nobody is going to be a pediatrician? Ah, good. What's your name? Hio? Hi. You're invited to come. And then we'll speak a bit about children in intensive care politics and my personal experience with taking care of special children in the Israel. So, you see on the map, this small country here is Israel. This is Asia and Europe. And I guess you recognize Mexico here. Israel is much smaller than Mexico. Mexico is 90 times larger than Israel. Israel square area is about 2 million square kilometers. And as you probably know, Mexico has more than 22,000 square kilometers. The population in Mexico is 130 million, which you probably know the figures better than I do, versus Israel, which have only 10 million, the population. The population density is also very different. In Mexico, the population density is 66 versus 450 persons per square kilometer. So you can imagine how dense Israel is and how small it is. But we still hear a lot about Israel on the news. That is where Israel is situated. You see, Israel is pretty small, and it's situated in an area where the geopolitical situation is very complex. It's surrounded by countries with which it has some historical conflicts. Some of them are still going on. But recently, there has been some normalization and gives us a bit of good feelings that the Abraham Accords, which were led by the United States with the United Arab Emirates and Morocco and Bahrain, which are down there in the Gulf, we are going to have some peace with them as well. Well, you see Israel is here, you see Egypt, Saudi Arabia, Iraq, Iran, which you probably hear in the news, and Syria. And that's Turkey. Mexico is somewhere here, pretty far away. And a bit about Israel. That's a population, that's a figure that shows the population in Israel. Israel was established in 1948. It got its independence. There were hardly 1 million persons in Israel. And nowadays, on 2025, there's 10 million people. This increase is one of the fastest population growth in the developed world and has many, many consequences. And the main reason for that are the ways of immigration that the Jews came from all over the world, mainly from Russia, and you see this sharp increase from, if Mexico would have increased this size by 10 years, instead of being 130 million, you would have been 1,500 million people. I guess the traffic jams would have been worse. So some selected economic indicators that I speak about. I speak first about GDP. You probably all know that GDP is an important indicator to measure the economic performance of a country. And under OECD countries, which Mexico is one of them, the average GDP is $55,000 per person. In Israel, it's 50,000. In Mexico, it's 25,000. That to give you an impression of the difference between the countries. So you see, all those figures are figures from the OECD, and you see, when we look at the years of schooling, that Israel is pretty high here on the top. This is Mexico, and Israel definitely stands out in its high enrollment in early childhood education. And it's again an optimistic number. But I guess you know what PISA is. PISA is an international comparative exam of school children's achievements. Despite the fact that schooling was here high, you see that the results of Israel are not very high. And we can go into that, but if you want to hear about it, ask about it later. But this difference stands out. One of the indicators of innovation are the patents per capita by country. And you see that, again, Israel, despite the fact that it's pretty small, is pretty high here on the list. And I showed you this figure because it's an indicator of innovation, technological advancement, and economic development. And it's nice to see that despite the fact that Israel has so many problems, you do hear me, right?
Yes.
It's a country of innovation. This figure shows the number of working years required to buy a home. And I brought this figure to show you that housing is very expensive in Israel, salary is low, and you see how many years you have to work in Israel to buy a home. Cost of living is extremely high, and it's one of the problems the young generation has in Israel. They have to work lots of years to do many on-calls. What about the health system? And I brought also some selected health indicators to show you what's happening. The first one is life expectancy. Life expectancy is an indicator of a country's overall health, development, and quality of life. And again, you see in this figure, the red line shows the life expectancy in Israel, which has, despite its being small and having lots of problems, economic, political problems with the conflict we have. You see the OECD is pretty much similar, and you do see what's happening in the United States, which is a neighbor of you guys. You see, despite the fact that they seem to be a rich country, the life expectancy is much lower than the countries here, and it's even decreasing lately. So stay in Mexico, don't go to the United States. Basically, life expectancy is a summary of measure of how well a country meets the basic needs of its people. It reflects good access to healthcare, sanitation, nutrition, and clean water. And countries which have a higher life expectancy usually have better education, economic stability, and social support. And again, this figure shows you the life expectancy in Israel, which is pretty high. So if you decide to leave Mexico, don't go to the States, come to Israel. I don't know how the residents work here. I hope you don't work as much as we work back in Israel. Now, fertility rate, that's also a pretty interesting figure here. The fertility rates are twice as high as the OECD figures, and you see that fertility rates are very high in Israel. And it's going up to 3 and even higher. Mexico has it pretty much similar, it's not that high, but what's more interesting is the fact that all over the world, fertility rates are decreasing. Here's Mexico. See, it has been very high, and it's going downwards, down here like the rest of the Western world. In Israel, it's been staying pretty steady all over the place, and it's even going higher. Now, there are different reasons for that. I just go back to the fact that pretty much fertility rates determine the future shape of a nation, both its size, age, structure, and economy. And in Israel, children are highly valued. Large families are encouraged. Israel offers general family benefits. And as opposed to that, low fertility rates are associated with modernity. What are the explanations for that? The childbearing is tied to historical continuity and national resilience. heightened effect of vulnerability, and demographic fears that if the Arab population grows, it might challenge the Jewish majority. A peculiar thing about Israel, as you know, we have, as opposed to you, we have recently had many wars around in Israel, and families of fallen soldiers can ask for the retrieval and preservation of their sperm after death. This is sparked debates on ethical, legal, and emotional issues, but it does show you the evidence of importance of children and the right to grandparenthood of fallen soldiers. That means if your son has fallen in war, you can ask for their sperm and later on have a grandchild, despite the fact that this father is not alive anymore. Infant mortality is reasonable in Israel. It's higher in Mexico. It's again a measure of health system quality, social and economic development, and economic stability. And a bit about hospital bed occupancy. I've been a patient here in ABC. I'll tell you at the end of my talk. In Israel, the hospitals are close to full. You see that it's the occupancy is here around 91%, and it's average. That means that many times we have 91%, that we have many times 80%, but the hospital overflows very frequently. And one of the impressions I had here when I came to the emergency and you guys were taking care of me, that everything was going very well, but there were not many patients around. One more thing is the number of Israeli physicians abroad, and you see that it's going up steadily. 14% of the Israeli physicians are working now abroad. Do you have Israeli physicians here in Mexico? You have?
In Israel.
Yeah? But you have Israeli physicians here?
Israeli that were born in Israel, not that I recall, but
No.
many that trained in Israel
Came back to Mexico.
Yeah.
We have actually a fellow in pediatric intensive care who's a Mexican, and she's going to go back if she doesn't find a husband in Israel. Now, healthcare in Israel. There's a universal healthcare mandatory coverage. The National Health Insurance Law ensures mandatory universal coverage for all citizens. The funding structure is through progressive health taxes, and the HMOs are open to every resident. Every resident is entitled to being taken care in the hospital. The Israeli health system is ranked very high over the world. It's the fifth. It's ranked fifth in the global quality, third in the efficiency, and 80% of the Israeli population have supplemental coverage as well. So that's a bit of overview about Israel, about the healthcare in Israel, and about the population in Israel. And now I'll go a bit into the Sheba Medical Center. The Sheba Medical Center, which I work. I've done my internship, residency, fellowship. I stayed a bit in Toronto to do my fellowship for a couple of years, then I came back to Sheba. Well, Sheba was founded in 1948. If you remember, this is the year that Israel was established. It began as a small military hospital that treated wounded soldiers, and over the years it's been transformed to the largest and most comprehensive medical centers, and stands out as a global leader in healthcare innovation in humanitarian medicine. I'll speak about it later. Basically, Sheba is now a city of health, an integrated ecosystem that includes 6 hospitals and multiple specialized institutes. Newsweek has ranked Sheba among the top 10 hospitals in the world. And it's a nice feeling to be there. And you'll understand later on why it's been ranked so high. And it's the highest ranked hospital outside the USA on the list. It's been, there's a lot of global recognition in Sheba. In 2013, it got the JCI Gold for Safety of Care, as you all know, is very important. Now, what are the pillars of success in Israel? The clinical excellence, extensive research, premium medical education, innovation, and global impact. I'll go a bit into each one of them. Regarding to the clinical excellence, it ranks among the top 10 hospitals in the world because of advanced patient care, high success rates, and very complex procedures. The research done in the hospital, do the residents do research here in? Well, I have an hour, Gideon told me. I have to go faster. You gave me an hour, I'm gonna speak for a full hour. I leave some time for questions. Okay. There's clinical and translational research. The education is, we are affiliated with the Tel Aviv University. We train medical students, residents, healthcare professionals. We're partners with academia, startups, and industry to develop cutting-edge medical technologies. There are a lot of startups in Israel. Innovation and global impact, I speak about later. Just a bit about numbers. In the Sheba Medical Center, there's 6 hospitals. There have been 1,600,000 visits annually. There are 200,000 emergency room visits annually. That means there are about 80 patients every day in the emergency room. Who works here in the emergency room? Nobody works in the emergency room? And that means a lot, 80 patients. I don't know how many patients you have in the emergency room here every day. There are 12,000 babies born annually in Tel HaShomer. There are 1,700 physicians, 1,900 hospital beds. How many beds are here in ABC?
400.
400 in each?
No, in both.
In both.
Okay.
And there are 100 startups done in Tel HaShomer. We have an extensive research. Since Adiel doesn't let me to speak a lot, I won't go into the numbers, but you can get the impression from this slide. The campus itself has 6 hospitals. It has an acute care hospital. It has a rehabilitation hospital. It has a hospital of gynecology and maternity center. It has a cancer center, a cardiothoracic and vascular center, and the children's hospital, which I'll show you a bit. We have a huge center for medical simulation. I've actually been here on a visit to your medical simulation. It pretty much resembles ours. I was impressed by your residents doing all those simulations here. So I won't speak about too much about the medical simulation, but just a couple of words. It has 17,000 medical professionals receive training each year at the Medical Simulation Center. We have there both simulation-based screening, licenses, accreditation exams, and emergency medicine training. We have crisis results management training. We have simulated clinical and surgical procedures and simulated patient encounters. One interesting thing is we have the virtual hospital in which we take care of patients out of the hospital. Since we have many places where people can't reach the hospital, we do it virtually, and a lot of a lot of things, and basically all professions in medicine, oncology, cardiology, orthopedic, gastro, ophthalmology, the patients usually don't have to go to the hospital. I don't know, do you have such a virtual? So you know about it already. We have international partners all over the world, both in Europe and the United States. I hope that after I come back to Israel, we'll have some partnership with ABC as well. Sheba gives global patient services. Patients from over 100 countries come to Sheba for medical care. And Sheba has been an international ally in times of adversity all over the world. Recently, 250 Israeli doctors came to Nepal in response to the massive earthquake that has killed 9,000 people. Sheba physicians came to Kathmandu and treated 1,600 patients there. We were in Haiti after the earthquake at 2010 and Sri Lanka at 2005. And you see the pictures here of our physicians all over the world. We're very proud of it. A bit about the Children's Hospital. It's again been established in 1948 as a military hospital. You see our nurses who had still caps there. Do nurses here wear caps?
Not anymore.
When did they stop?
About 30 years.
That's interesting, the fact that they don't. And in Israel, they don't wear a cap as well. They were taking care of all the small babies here at the hospital. You recognize this man? And this is how the hospital looked at that time. I'm very proud of the Children's Hospital. And you see that it offers a diverse range of specialized pediatric care. We have general pediatrics, 3 departments. We have ambulatory pediatrics. We have pediatric surgery. We have pediatric psychiatry, radiology, a department of academic pediatrics, pediatric research. We have a huge hem-oncology department in which they do both BMT, and we take care of all hem-oncology. We have a big neonatology department, and we have a big congenital heart center. So if any of you is interested in coming for a sabbatical, for a time for a part of your residency, you're invited. Now I come to a different issue in which I speak about the Israeli healthcare system and the perspective to the Israeli-Palestinian conflict. I don't know if you heard about it, but I'll give you some highlights about that and what we're doing. As you know, these times are charged times, and it's an opportunity to examine the healthcare system as a lens on the Israeli-Palestinian conflict. Israel's healthcare system is known for its universality, as I said before, but it reflects many of the complications of the Israeli-Palestinian conflict. I don't know if you know the number, but Arab citizens of Israel make about 20% of the population. That means we have 10 million citizens in Israel, 20% of them are Palestinians, and all these people are presented as patients and medical staff. They all have access to public health. Palestinians themselves rely on their own health ministries, international aid, and refers to Israeli hospitals. I speak about it. And I want to mention that the data that I'm presenting here were collected about 5 to 10 years ago. So it's a couple of years before the current situation. Now, this is the Gaza Strip, which you heard about probably on the news. It's been sadly been often in the news in the past 18 years. Um, uh, I can't see it very well from here, but this is where the Gaza Strip is. Okay, this is Israel, this is the West Bank. Since 1967, it's been occupied. The population there has about more than 2 million people. The density is very, very high. If you remember the density in Israel, it's about 400 persons per square kilometer. In Gaza, it's much, much higher. In 2011, 80% of the population were beneath poverty line, 45% were chronically undernourished, 80% depend on humanitarian aid, and only 10% of drinking water is drinkable, and all those numbers are by the WHO standards. From 1967 till 1994, Israel was responsible for vaccination and primary care. But from 1994 on, that was 30 years ago, the health system was under the authority of the Palestinian Authority, who was in charge of the civil services, which mean both education, health, and transportation. Since 2007, there have been repeated surges of violence, during which the healthcare was heavily damaged there. Facilities were destroyed and people, including children, were injured and killed. There has been an Israeli blockade. There have been since then many casualties and wars. There was pervasive damage, no repairs, reduced services, and there was an acute dependence on external resistance. Sorry, that's my daughter. Some comparative figures. Maternal mortality rate in Israel is 6 per 100,000 people in Israel, as opposed to 29. Just to let you know that in Mexico, the maternal mortality rate is 73. Infant mortality rate in Mexico is 11, which is very nice. In Gaza, it's almost 29. In Israel, it's 4.7. And as you see, life expectancy is pretty similar. It's a bit higher in Israel than in Gaza. Education in both places is very nice. I spoke about school life expectancy earlier in my presentation. In Gaza, it's 14 years. In Israel, it's 15 years. It's a nice number. And the population is very literate, both in Gaza and in Israel. Two interesting things are the number of cellular phones, which are very high in Gaza despite their situation. The country world comparison is 72. In Gaza, 26 to 52% of the children suffer from anemia. About a half have severe deficiency in phosphorus, calcium, and zinc. They have prevalent respiratory infections, and there's some war trauma, more than some, food, electricity deprivation, anxiety, aggression, and antisocial behavior. You have to know that overall worldwide prevalence of anemia in toddlers is 40%, so it's not that bad. In Mexico, it's about 24%. Now, when a child needs some thorough medical treatment, they have to apply for an exit permit to Israel. It's not easy. It's a subject to permit regime. There are some movement restrictions, checkpoints, delays, and refusals. About a third of the applicants miss their appointment, and some 46 Ghanaians died during 2008. We're waiting GCSS approval. The exit permit is granted by the security service and not by physicians, and children with life-threatening conditions can apply. The funding for those children is from the Palestinian Authority. They all considered medical tourists. It's deducted from tax repayment. It's being paid partly by the Palestinian Authority, as I said, and by the Israeli Paret Center, which is an Israeli organization which contributes to the treatment of Gaza children, and Physicians for Human Rights, which is an Israeli NGO. So to sum up, the children there have poverty, they have environmental hazards, continuous war trauma, deficient health care system, political restrictions, and dependence on external aid. But still, Israeli hospitals reach thousands of Palestinian children and adults each year. When a child comes to the Israeli hospital, and in Sheba and in the Safra Children's Hospital, we take care of a lot of Palestinian children. It's very challenging for the child. The families are confined to the hospital premises. They can't go out. They're disconnected from the family at a very highly stressful time. They are at unfamiliar surroundings. They have a very extended hospitalization because it's very difficult to go back to their home. Many speak only Arabic, despite the fact that we have many Arab staff working in Israel. And they encounter with economical prosperity on the other side of the Israel. And the staff all feel that the Palestinian children and families should be grateful. This is a picture of a child, which I'll tell you about, which I've been taking care of. But when they come to the hospital, the staff is very devoted, and the treatment is cutting edge. Now, this child, this is Dr. Raz Somech, who is his Israeli physician. This is a child whose name is Muhammad, and this is his grandfather. And I'll tell you about him a couple of minutes and show you a short film about the child. I still remember it was about 20 years ago. I was called at night that Muhammad, this is a child here, who has a very complex immune deficiency, is on his way from the general pediatric department to the ICU. The physician who was taking care of him thought he's in septic shock, and this was around 2 o'clock in the night. I was called, and the resident told me, listen, Muhammad is a 6-month-old child. He has immune deficiency. He has high fever. He's very tachycardic. He's got poor perfusion. His blood work shows extreme leukocytosis, lactic acidosis, and he's very tachypneic and dyspneic. I live not far away from the hospital. I came to the hospital. We spent around 3 days trying to save this child. We did save him. He got lots of support. He was intubated, ventilated. He got lots of inotropes, including noradrenaline and adrenaline and vasopressin, and he was fully covered with antibiotics, and he eventually survived, despite the fact he had a very severe immune deficiency. But sadly enough, he lost all of his limbs. That was when he was about 6 months of age. I want to show you how devoted the staff was. Can we put on the film?
Pueden poner el video, por favor.
ולהגנה.
עכשיו לסיפור אחר לחלוטין. בבית החולים תל השומר מאושפז זה 3 שנים מוחמד, ילד פלסטיני מח'אן יונס שהרופאים נאלצו לקטוע את 4 הגפיים שלו בשל מחלה נדירה. משפחתו מתנכרת לו, ורק הסב מלווה אותו יום יום בדרך לשיקום חייו. הנה הכתבה של דורית סטאריק,
Lo adelantamos un
כוח החיים.
poquito. Esto salió en las noticias de Israel. Un poquito ahí.
1 minute.
Shama.
בדקה,
הנה.
דקה, לא, עוד קצת.
כל החיים שלי איתו, ואין לו אף אחד חוץ ממני.
מוחמד נולד בח'אן יונס, לוקה במחלה גנטית נדירה. בגיל חודשיים החלה בריאותו להידרדר. הרופא המטפל בעזה המליץ להעבירו בדחיפות לבית החולים ספרא לילדים בתל השומר.
איזה את הכל? שנתיים.
כשהיה מוחמד בן 2 נאלצו הרופאים לקטוע את 2 רגליו ואת 2 ידיו כדי להציל את חייו. כ3 שנים, ובעצם כמעט כל חייו, מוחמד מאושפז כאן.
נעזרנו תורם חיצוני.
הפנייה לתורם האלמוני, תורם יהודי דווקא, הניבה סכום של 100,000 שקלים.
He grew up in Tel HaShomer, in Sheba. Tel HaShomer is called Sheba. And I'm just speaking about the devotion. He's been hospitalized in Tel HaShomer in Sheba for months. And despite the fact that he's coming from Gaza, we paid for his prosthesis, and he stayed. He's now he speaks Hebrew. He's been living in Sheba for his rehabilitation, and he's a very happy child. If we move to the 28th minute of the film, you see how he is now.
Pasamos al minuto 28, por favor. No, there is no. Aquí te. Gracias.
That's fine. We can stop it. We'll go back to
La presentación, por favor.
We'll go back to the presentation. Now, this
Pueden
child,
parar el video, poner la presentación, por favor.
in very few departments in the world, this child would have survived and would have gotten this treatment. The grandfather who's taking care of him is now working in Sheba, and the whole family was brought up in Sheba. This child is now 16 or 17 years old. He's going to school. He's running. He's happy, and it's just show you the devotion of the physicians and the staff in Israel to those patients who are coming from abroad. So I'll go on with my presentation. One of the things that I told you that it's very difficult to be a patient who's not speaking Hebrew in Israel all over the place, but we have lots of Arab staff in Israel. We have lots of Arab physicians who we work with. We have lots of Arab nurses, lots of Arab pharmacists, and we all speak. They all speak Arabic with the patients. This is what the children's department looks, and it's a big difference from the hospitals they had in Gaza. And you see what this child encounters when he comes to Sheba Medical Center. I'll finish with this movie, which is called Precious Life. It's again a full-length Israeli documentary, acclaimed by critics and celebrities. I'm sure you can find it here in Mexico as well. It has been declared as the best documentary of the year in Israel, and internationally it's shown in prestigious festivals and quality TV channels, praised by key US media figures, and was shortlisted for the Oscar Best Documentary Award. It's even been listed in Wall Street Journal's 10 Best Movies of the Year. So The storyline is about, again, the child was called Muhammad. It's a Gaza Bubble boy who needed a bone marrow transplant. He was in Sheba Medical Center. We found funding for him, and we tried to do the best to give him the best treatment and bone marrow transplants. I'm sure you know about Christiane Anapur, the HBO from HBO. She was on the show. She was very fascinated by the movie. Now, just to speak about the cover of CD-ROM, you saw this child, Muhammad, who needed a bone marrow transplant, getting an IV here. See the IV? And what you see down here is an explosive belt. And it's related to a scene in the movie in which the mother said that she wouldn't care if he became a shaheed, that means a martyr, willing to sacrifice his life to the sake of freeing Palestine. I suggest you see the movie. It's really very moving. And I want to end by the fact that I'm very proud of the healthcare in Israel. It does offer a space of cooperation and coexistence of the Jewish-Palestinian population and a bridge for peace and confidence for building measures. And you saw the example of two patients we were taking care of and saving their lives. I want to thank ABC at the end. On one of my nights here, I didn't feel so well. And I was wondering which hospital to go to. And they told me that ABC is the best one. So thank you, ABC. That's me. Adiel was taking care of me. Two of the residents who were really marvelous. I don't have pictures of the nurses. They didn't agree to take a picture with me, but I had a wonderful experience, and I wanted to thank you for that. And again, muchas gracias. I'm ready to answer any questions you still have. I'll be delighted if after my talk you decide to come to Israel. I'll give you a very good time. Food in Israel is also very good. It's almost as good as the chapulinas I had here. So, Adiel, thank you very much.
Well, Gidi, thank you for your talk. I think it was enlightening for all of us. Si hay preguntas o comentarios, si las quieren hacer en español no hay problema, las traducimos. Si las quieren hacer en inglés, aquí o en Santa Fe o por vía Zoom. En el chat ahorita no tengo a nadie que esté levantando la mano o que tenga algún comentario. Creo que el doctor Halab está allá en observatorio. Pepe, ¿algún comentario?
I didn't understand what Adiel asked you. But,
if they have any questions.
But I want to hear from the residents where they're working. So I know you want to be a pediatrician. What is your partner?
El micrófono,
Just tell me your name. No, you're... מה? לא חשוב, נדבר איתם בינתיים. So how many years have you been a resident already?
Actually, not a resident yet. I'm in my medical internship with Presentada.
Yeah.
This is my last week here in the medical center, but it's been really good.
Yeah. So you're invited to come to Israel, and your partner there is sitting. Then, what are you planning to do? What's your name?
Andrea.
Andrea. What are you going to be?
I want to be a surgeon.
A surgeon? An ENT surgeon?
What?
You want to be like a DL?
Plastic.
Dr. Ash?
I want to be in plastics.
Good. Women go here? What?
We have in Zoom, doctora Gerson, si quiere hacer algún comentario.
Claro. Metsuya Toda Raba. I want to tell you that You really
Muy
have to
bien
be
y que muchas
proud.
gracias.
Gracias, aprendiendo, recordando. Pero I was in a meeting, in a hospital meeting at Northwestern last week, actually from children, but from adults. And we were speaking about the best hospitals as Northwestern was, and I studied there. And they said, your hospital. And you said, and they said Shiva Hospital with that, what you said. My question now, and congratulations, is oncology clinical trials. And of course, we would love to do studies with you. In the meetings, you are really well known. So I would like to know two questions, cardiology and oncology, pediatrics and adults, about clinical trials. And I was very proud in the meeting in Northwestern underlined Shiva. Congratulations.
Thank you so much. Thank you so much for the congratulations. Since I'm not an hematologist, I can't speak about the specific studies they're doing. I know that they're involved in a lot of studies. Since I've been in charge of the pediatric cardiac ICU as well, I know that there are a lot of studies done in children regarding the preoperative, operative, and postoperative. We have an extensive research program dealing both with basic science and clinical epidemiology of those patients. And if you'll send me an email, I'll be happy to send you the relevant information. I'll be more than happy to do some progress with combined studies with you guys. Again, you have a marvelous country. People are wonderful. I'm sure the medical system is even great as well.
Thank you. Thank you very much.
El doctor Ezequiel en observatorio.
Thank you indeed for your experience, your soul, and your mission. And the most important that I take from this lesson is we should take life, never mind countries, never mind political things. Our mission has medical care is take care of every human. Thank you very much, Professor.
Yes, thank you for this comment. I completely agree. As I showed you, as medical staff, both nurses, paramedical personnel, and physicians, our devotion is to our patients and to the children, and that's something that I'm sure is worldwide.
In the chat, Dr. Toral asks if how many patients you have in average in the ICU, in the pediatric ICU.
We have two ICUs. We have a general ICU in which we have 22 patients, and we have a cardiac ICU in which we have 8 acute care beds and 10 subacute beds. So overall, we have around 50 beds in the ICU division. Well, we have an extensive cardiac surgery program. We have about 400 open heart surgeries. We have an ECMO program, and again, I'm inviting you to take part in it.
Bueno, pues parece que ya no hay más preguntas ni comentarios. I'd like to thank you for your talk. I know you're traveling back to Israel right now in these difficult moments, and you made a time to be with us, Gidi, and I'd like to, in kind of our appreciation, and this is little
Wow.
Let's move here. Let's move here. All right.
A little present for you. It's not too heavy, so you can put it in your luggage. And you can see the pictures of the countries that you like so much, Mexico, many pictures of Mexico.
Thank you so much. It's been really a marvelous time we had here.
Here is the microphone because
It's been a marvelous time getting to know Mexico. I want to thank a couple of people who showed me around. Adiel, who's a real friend, his wife, Sarah, who gave me a wonderful time and dinner, and my partner, Professor Daphna Carmeli, who's an anthropologist, and helped me make this very interesting presentation. And Yasmin, I was impressed by your hospital. Thank you so much. I had a wonderful time. You're all invited to Israel. I'll give you my phone number, my email, and you'll have a wonderful time in residence there. Take care. Thank you again.
Estamos dando la carta de agradecimiento. Les recordamos también a la conferencia que va a ser abordaje multidisciplinario del piso pélvico, que será el próximo martes 1 de julio. Y les recordamos también nutrición y rehabilitación en el paciente crítico, 3, 4 y 5 de julio, aquí en el auditorio. El curso de cirugía laparoscópica, el cual será llevado a cabo también transmisión vía Zoom de cirugías en vivo en el segundo día, 19 y 20 de septiembre del 2025. Y no olvidar, quien quiera acompañarnos en el crucero, el precio está excelente, del 1 al 9 de noviembre, el crucero por el Caribe saliendo de Miami. Gracias.